Let's talk about the third part of intracranial hemorrhage. In this, we will discuss about the subdural hematoma. Subdural hematoma, it is actually a condition in which blood accumulates in the subdural space. So let's talk about this space, the subdural space. Actually, subdural space, it is a space present in between the two layers of the meninges, which is the dura and the arachnoid. Okay, in between these two layers of the meninges, the space present, this space named as subdural space. As its name indicates, sub means below. So this is a space which is present below to the dura, and we know that the layer just next to the dura is the arachnoid matter. So the space present between these two layers is this subdural space, and if the blood accumulates in this subdural space, we call it as subdural hematoma. So now the question arises that what leads to the accumulation of this blood collection? Okay, actually normally in this subdural space there is actually blood vessel present, which is known as a bridging vein. Okay, why it is called bridging vein? It is because that in the subarachnoid space, in this space, there are superficial veins. In the epidural space, there are dural sinuses, which are also the veins, the venous drainage pathway. So actually the veins present in the subdural space are present between these two veins, the dural sinuses and the superficial veins. So that's why they are named as bridging. Okay, so the bridging veins named just because of this reason, that these veins, the veins present in subdural space, present between the dural sinuses and the superficial sinuses. Okay, so actually these are the veins which are responsible for the subdural hematoma. When these bridging veins get ruptured, get torn due to any reason, it leads to development of this hematoma formation. Okay, I mentioned here that blood collection in the subdural space due to the rupture of these bridging veins, which are present, normally they are present in the subdural space. If they get torn, it will lead to the hematoma formation. So let's come towards the causes, that what cause behind that which lead to the rupture of these bridging veins and ultimately leads to the hematoma formation. So let's come towards it. Actually there are many causes I mentioned here, but the topmost are the traumatic, and in the traumatic, the topmost is the head trauma. Okay, the head trauma, and especially in the case of the motor vehicle accident. Okay, why? You should remember that these bridging veins get ruptured whenever there is a disturbed relationship between the brain and the skull bone. Whenever their relationship gets disturbed, there will be the chances for the rupturing of these bridging veins. So in case of the motor vehicle accident, the relationship between the brain, this is the brain, okay, this whole is the brain, this is the skull. Whenever the relationship between these two get disturbed, it will lead to the rupture of these bridging veins. There are chances that they can got ruptured whenever their relationship get disturbed. Okay, so what happened in the motor vehicle accident, and if there is a like type of injury, acceleration and deceleration type. Let's talk about this. Say for example, a person is driving a car and he got hit by some other car or tree or some other thing else, and his head fly forward. So what will happen? As his head fly forward, then his brain would hit the front part of the skull bone. So the relationship would get disturbed, and there will be the high chances for rupturing of these bridging veins. And as his car gets stopped, what will happen? His head would fly backward, and what will happen? Again, his head would hit to the back part of the skull bone, and again there will be the high chances for the rupturing of these bridging veins. Clear? So this is the topmost reason for the development of the subdural hematoma. Head trauma, and especially the motor vehicle accident. Let's come to the next one, the minor injuries. Minor injury, not in a normal person. Minor injury, if it is occur in those who are having the cerebral atrophy. Cerebral atrophy means that they having a small brain, okay, shrunken brain, and those people who are having a shrunken brain, in them the relationship between the brain and the skull bone can get disturbed very easily, because the brain is shrunken. It can easily get disturbed. Okay, why? Because the skull bone is of the same size, while the brain is got a smaller size. Okay, not as the previous, as a normal one. So what will happen? Their relationship can get disturbed very easily. Like a minor injury can disturb their relationship and can lead to the rupturing of these bridging veins. Okay, so let's talk about that. What are the causes behind the cerebral atrophy? Cerebral atrophy can occur in the old age. Cerebral atrophy can occur in alcoholics, and cerebral atrophy can occur in some of the neurodegenerative diseases such as Alzheimer's disease is the topmost. While the Lewy body dementia, in that there can also be the cerebral atrophy. So we can say the cerebral atrophy is one of the risk factor for the development of the subdural hematoma. Okay. Now come towards the third one cause, the shaken baby syndrome. As its name indicates, there's some condition in which if you shake baby's head, there's not mentioning the head, but actually the shaking baby head very rigorously can lead to the rupturing of these bridging veins. Okay, why? Because babies having thin cerebral veins, that they can easily torn if even get a minor injury. So if someone shakes baby's head very rigorously, even for a purpose to stop crying them, that condition can lead to the subdural hematoma, just because of the reason that children having thin cerebral veins, thin bridging veins, and they can easily torn if their head is being shrunken very rigorously. Okay, is shaken very rigorously. Let's come to the non-traumatic cause. They are not too much common, less common causes, but they can lead to, but not the main causes. The main cause is the head trauma, and then these two. These are the least common causes. Okay, let's come towards it. Like coagulopathy. Coagulopathy, there can be decreased platelets. Okay, one reason. The second is that if the person is using the anticoagulants, say for example, if the person is using the heparin or warfarin, or if the person is using the antiplatelets like aspirin, in these conditions, what will happen? Even a minor trauma to the bridging veins or to any other vessel won't heal, like the clot won't form, and even a minor trauma in a vessel will lead to more and more blood loss, and ultimately can lead to this hematoma formation. Say for example, this is a blood vessel, okay, and it get torn at this area, okay, and now from here the blood is moving out, and normally what happens that in a normal person with normal platelets count, with no any coagulopathy, what happens is that in a damaged area a clot form after some time, and then it bleeds a little, and then it won't bleed anymore. While patient with a coagulopathy, what will happen? That the clot won't form there in the damaged area. Then what will happen? It will bleed more and more and can lead to this hematoma formation. Clear? In case of the people having the AV malformation, like arteries and the veins are malformed. If the veins are malformed and if the veins are the bridging veins, then they can easily rupture, it can easily bleed, and can easily lead to this condition, the subdural hematoma. But should remember that traumatic and traumatic, the head trauma is the top most common cause. These are the least cause. Okay, these are not as common as this one. This is the most common cause for the development of the subdural hematoma. I mentioned here the acute subdural hematoma and the chronic one. Let's talk about this. Actually, it is the bridging veins, like veins, and we know that the veins having less blood flow, like they are not as faster as the arteries are, like their blood flow are slower than the arteries. Okay, so most of the time that if they bleed, the subdural hematoma condition, they most of the time present chronically, that even the patient forget about their trauma history, and it is especially in the case of the cerebral atrophy. In these cases, if you ask history, that do they have the history of the trauma or any fall, they would say no. But if you ask again and again, that remember, even the fall or even a minor trauma they had experienced a few days or few weeks before, then they might remember, yes, they got a minor injury to the head or somewhere else. Okay, so most of the time it presents chronically, especially the cerebral atrophy. Okay, cerebral atrophy, in the cerebral atrophy case, the subdural hematoma, if they get formed, it most of the time present chronically. And the head trauma, especially if the head trauma is so rigorous, if the blood vessel get torn a lot, if the bleeding has happened too much, that the hematoma has formed very fastly, then it can present acutely. Okay, but if the head trauma is not so severe, then this hematoma formation would form would take time to form. It will come in the category of the chronic case. Okay, I mentioned about the chronic and acute cases in the epidural hematoma. Like epidural hematoma most of the time present acutely. Why? Because the epidural hematoma was that which developed because of the rupturing of the meningeal arteries that were the artery, and we know that the arterial having a faster flow, and that hematoma, the epidural hematoma, has formed very fastly. But in case of the subdural hematoma, we would see the condition that whether the condition is much dangerous or if the condition is of the chronic phase, then according to that it will present in acute or in a chronic phase. Clear? Let's come towards like how these patients will present. We talk about that what is subdural hematoma, we talk about the definition, we talk about the causes. Let's come towards clinical features, that how they will present, how we can pick up these cases. Okay, so let's talk about it, the clinical phase. Okay, like most of the patient, like they will give the history about the headache, about the loss of consciousness, that when they get head trauma they lose their consciousness, and if the bleeding is continued, they can even present to you with the deteriorating mental status. Okay, and in this category there can be the neurodeficits, there can be the herniation symptoms, seizures, and even the Cushing's triad. These all are just because of the compression of the brain, underlying brain parenchyma of that hematoma formation. Okay, like this is the brain, and the hematoma has formed in this area, say for example, and now as hematoma is enlarging, it will does what? It will compress the underlying brain, and according to that, according to the location that which area is being compressed, according to that damaged brain part, the patients will present with these neurodeficits, focal neurodeficits, according to the brain area which is being damaged. Okay, and it can even lead to the herniation. This is actually a CT scan which I will talk when I will discuss about the diagnosis. Actually this part, this more darker part is the subdural hematoma. Okay, now it can lead to the herniation too. If the hematoma is getting more and more enlarged, it will lead to the herniation. Herniation means what? Herniation means that the brain tissues will move from its normal area to the other side. Say for example, if this hematoma form too much, the brain, this is the underlying brain, it will shift to the other side. Say for example, now this brain part will shift to the other side. Okay, and then according to that, the patients will show symptoms. Clear? The patient can even present with a seizures attack. Why? Seizures because this hematoma formation can disturb the neuronal fibers, and when the neurons get disturbed, they will fire abnormally, and abnormal neuronal fibers can lead to the seizures attack. Okay? And whenever this hematoma form, if as it gets enlarged, it will lead to what? It will increase the intracranial pressure. Okay? And what will happen? Increased intracranial pressure would present in this triad form, Cushing's triad. Triad means 3, so it will give the 3 points. Like there will be the systolic hypertension, there will be the bradycardia, and there will be the irregular breathing. These 3 points come under the heading of Cushing's triad, and it happens whenever there is increased intracranial pressure. Okay, so let's come towards the diagnosis, how we will diagnose this case. Actually, I talked about that it can be due to the coagulopathy. Okay, so if we are suspecting any coagulopathy, any history that the patient are using the anticoagulant drugs, so we do the COG profile, like we check about the platelets count or PT-INR. Okay, we can do that, but the topmost is the CT scan of the head without contrast. This is the best modality of the choice. We do that and we can easily diagnose that. And how we will pick the diagnostic points are these. Like the hematoma will be of the crescent shape. As you can see here, this is actually the darker one. Okay, the darker one is actually what? Is actually the hematoma, and it is of crescent shaped. Okay, and it can cross the suture lines. It can cross the suture lines. They are not bounded to the suture lines. While in case of the epidural hematoma, I mentioned in my previous video that they do not cross the suture lines. So this is a differentiating point between the epidural and subdural hematoma, that it is of crescent shape, while the subdural hematoma was the biconvex shape, like it was like that. Okay, biconvex shape, while this is of the crescent shape, it will be more extended. Okay, and the epidural one could not cross the suture lines, while the subdural can cross the suture lines. Let's come towards this point. I mentioned that it can present in acute form or in the chronic form. In acute case, what will happen? That the blood will be fresh, and fresh blood looks more brighter than the brain parenchyma. And you can see that this blood is not brighter. It means it is not the acute blood collection. It is a chronic one. Okay. So in case of the acute blood collection, on the CT scan, you will see the hyperdense blood accumulation. Hyperdense would look more white, more brighter than the brain. While the chronic one, like this is a chronic, this is a CT scan of a patient with a subdural hematoma, and that hematoma is the chronic subdural hematoma, because we can see that this subdural hematoma is looking hypodense. The hypodense will be darker than the brain parenchyma. Okay, so you can pick these two, whether the condition is acute or chronic. Clear? Let's come towards the treatment, that how we will treat these cases. We can reverse the coagulopathy. If we are suspecting that they are decreased platelets, we infuse the platelets. If we are suspecting that the patient, if we come to know that the patient are taking the anticoagulant drugs, we reverse the coagulopathy. But if the condition is deteriorating, like these, if we see any of these, or if we see that the patient's loss of consciousness is decreasing with time, like Glasgow Coma Scale, like GCS score is decreasing, we have to immediately move towards the surgical intervention. Either we can go to the craniotomy or to the burr hole. Okay, and we have to remove this. We have to equate this part very immediately, because this can be if these neurodeficits being shown, if this deteriorating mental status being shown, it means the condition is going to the worst. Okay, so we have to immediately equate this area. Okay, if the patient is showing the increased intracranial pressure symptoms, we can give the mannitol and hypertonic saline too. It will does what? It will decrease the intracranial pressure. And if you're suspecting the seizures, or its anti-seizures can be given prophylactically. Actually, these two are given in a condition if the condition is deteriorating. Okay, if the patient's condition is deteriorating and the surgical interventions cannot be taken place immediately, then at that time we give these two, mannitol and anti-seizures. Okay, to prevent what? To prevent the seizures attack and to decrease the intracranial pressure. That's the end.